full kesia sano. It means that you have spent more than 1,700 calories in just one meal, because fish want the calories, fufu so want the calories, and namne and quine bibiano want the calories. It's a portion control no. Enti and area the medija mona said, be deliberate. Yes, count the calories. Be intentional. Be mindful. Nyamebe boyen damase.
Yes, sir. That was it, Dr. Frida. Next up, Dr. Hannah. The topic is coping with stress.
Thank you. Thank you, Dr. Frida. So, something that I want to bring up and ensure say you understanding and may at this point, let me go ahead and share my screen. Okay. So we talked about coping with stress, and I know say Dr. Che Ekra Emma feedback on the stress and the effects of cortisol in the body. Into just a few points I'm me address and I may answer another thing that came up. Into cortisol na yekasa release is going to cause a lot of these effects na yeshe on the side of the screen. Me can say a bit me hawa kumano. One of those release of glucose in the body. If you're under constant stressor, now stress hormone cortisol release, you're gonna break down proteins from your liver. You're gonna get glucose running in your bloodstream. Now, so when you exercise, burning some of those glucose now, you're going to end up storing them as fat into you be obese, and then that will lead on to some of the complications. Now, about wakumano. You're going to end up with high risk for high cholesterol, heart attack, and then possibly stroke. Intimapacho symptoms of the stress, now we baby, now we cope, like we mentioned. No. The other thing I wanted to go over, and I'm not sure why my slide will not go to the next page, was the compassion fatigue. Compassion fatigue, there are some physical and emotional impact of that. I got somebody that reached out to me after the presentation, taking care of Ubi or Yare for a long time. It can be very, very hard. So these symptoms now, you are almost like burned out. Try and get some help. Say be crowded to me, send or ahanas or insurance. You can maybe get some nursing assistant in the home to help with the taking care of them, And I say, phobia, because when you're under constant stress and these physical and emotional symptoms, it's going to just get worse, and then you're going to get sick eventually. As I said, Bibi to say emotionally, if you are under constant level of anxiety, and no cortisol, you're going to end up having a lot of cortisol secretion in your body that's going to cause you some complications in the long run. If you're depressed, depression is going to end up making you not feel good about yourself. You're going to be emotionally unstable. If you're suicidal, say suicide every 40 seconds. We have about one person that's dying in with suicide. This is about, you find say 1 hour, I'm said Danamekano. You find say about 1 hour, nipa 90 in a baby within the next hour from suicide is very detrimental. You can't help yourself at some point when your brain decides to go another way than what you want it to go. And so help is available. You can cope with this with the help of God, and also using what has been proven to be supported for sa Nyekosono. There controversial feedback from, I mentioned yoga and the data that shows that yoga and meditation helps to control or to cope with stress. And what I had meant to say is not relating yoga in a spiritual way, because I do know many thousands years ago, this was something that was derived from Buddhism, Hinduism, and that is definitely not what I'm trying to portray, because Seventh-day Adventist. However, the movements that came out of yoga, from the time it was found or studied, is what I was recommending, because scientifically, there are benefits to this. So we call internet type of benefits of yoga. You will get a lot of things, and there's something here that I want to read to you with regards to that. Now, or say the U.S. military, the National Institute of Health, and other large organizations are listening to and incorporating scientific validation of yoga values in healthcare. Doctors will recommend your patients to a yoga therapist, and not the NSC do extreme. That is not what I'm saying, because yoga therapists, why? They're going to use some of those things that maybe it will have some spiritual entanglement with it. May let me go and say the movements that are recommended with yoga activities. So BB, for example, like this tree pose now, it really helps you balance and keeps your muscles flexible. Into BB saying, oh yeah, so you are taking in deep breaths while a soft music, maybe classical hymns being play in the background. Your goal is to try and relax your body with those movements now, so physically into one point. Another pose, say cat cow pose, and also a bow with your stretching of your muscles and improving flexibility. Dr. Benamo Ebeka say, your back muscle, your back joints they are vital to your overall health. So achieve how into this pose, for example, to really improve your flexibility in your torso and then also in your back. It's your choice if you want to incorporate this again for the scientific benefits, but not for the spiritual part of it. This is one of my favorites because our movement we this is the legs up the wall pose. Just think about gravity. So you're getting a lot of relaxation to your brain, which is controlling many parts of your body. So this pose helps to relax you and helps you to even sleep. Why a tense, why a stressed out, music be in the background, you've turned off the light and you're just doing this pose. It's gonna put you at ease, it's going to relax you. You can definitely sleep better. I know it has helped me in the past because it works. So I wanted to recommend that. And then somebody was mentioning, said, make us an say, like fufu we make have maybe the broccoli so obviously na broccoli fufu there. How do we even eat that for most of our Ghanaian communities? Maybe you're not used to that. It's okay. Dr. Frida Kasano, okay, 1 cup of broccoli is about 5 grams of fiber. Into fiber is definitely something you need in your diet to help you with your regulation. Into broccoli na maybe I'll be to carrots. So carrots na maybe you can do spinach. Anything that has green leafy vegetables in general is what we're recommending to help you balance your diet. Into again, we're giving you recommendations. You make the choices on things that will help you. We're giving you the foundation and yet prescription. So I hope this helps you so that continuing together along with all of us, we can cope with stress in our lives. And again, music is a great support for us. Remember that you ought to keep a cheerful heart. At this one, however, remember, say, when your heart rejoiceth, you are actually doing yourself good. Also keep a joyful heart, because if the universe owner, the God of the universe, and your friend say what else do we have to worry about? We will do our part and leave the rest to him, and he will help us through it. And I thank you for this opportunity again, and I wish you all the best in your healthy lifestyle choices. Amen.
Amen. That's Dr. Henry. The next speaker, Dr. Philip Oforiyen to me. The topic is dealing with dependencies and addictions.
Yo, Dr. Usu, yeah, that's it. Unfortunately, some book I didn't mean to, but the sound of food excites me. So maybe the idea of dependencies and addiction. But I have a confession to make though before I move on. Dr. Frida, maybe the NSA. Say me call Ghana. I have not 2 aims. 1, to release stress, which is Dr. Hannah again. 2, say because we didn't near. Metia minyendi. But the other have is a withdraw be diba koda no pana. After the night, she me because I want to be able to eat. But we didn't did that much into the chair. So that leads me to my topic, right? Addiction. I don't know what your addiction is, but I want to say, addiction, you want to be brave and yet discriminatory. Me part of yes, for yare and here for yare. And I Sebio Yensa, you pay the adenoso yare, right? We want more pay the anessa, but then they have an addiction to something in particular. Okay, addiction so you're limited to Adrianenkwa. And you know, your new maybe it puts us at risk. And my one thing, yeah, you bet me, I am addicted to BB. And you know, and you may be not put you at risk, you know, and I say a risk factors, you know, it be your genes and make us about nature versus nurture. You both say I see boy. And as I say, you nipa buy no. And you know, everyone who not run it through their family, but it be a not one another dear no koye and sa. Who baby who Christo into no sa. And it be no addiction of be before for. Your how so say be addicted to a substance and as say anything at all. It affected the formation of our brain. No, and you know, a money day say after the bejai. And in terms of your environment, and also no, our neighborhood, maybe a benny enough for a befa, and for a no mobile grow, Sano many no, it may affect here. Then it affects the choices that we make. If one my own make us and then the woman tia, yes, say curiosity kills the cat. Sir, and your man after the uncle Jima. Okay, and your maybe son, it be addicted to the Dika media nubi. Ediane. Oh, and the enemy would be brave. Last, my MBA who yet done as I saw share the dear no. None of the popcorn. You might think, say, no, so dear. Yes, Obia day different. Obo no more ye man, no, I started AD, I law, shre, and yes, I knew man, those piker foods now. After the Obe, you know, now I be call honum not Upebi Eddie all the time. And I abuse the sex. When we talk about sex, I think the other day I didn't stress so much on that. It's not just actively being involved with your partner. Then they start going around. They start masturbating and all of that. Then gaming. It has become so convenient to become addicted to game. And as I say, gaming. Okay. And I also say betting. Because right now, no, they've linked it to something that we like, which is sports. And they've also brought it on our phone. And it's convenient. I don't know what about social media or internet addiction. Because say anytime you're addicted to something, no, say if you have the withdrawal symptoms. And to a boy was or peer pet not ordinance bonny bottom, maybe or take keeping the phone. Because who say new on feeling okay, they have to make sure that they have it before they can step up. Maybe OPA I could do on my basis here, but the phone can hold crumple now on to me and no honum. And some about drugs, you know, the prescribed and unprescribed. And there is a very important point. Dr. Ben Opoku Bediako legal does not mean safe. Once again, popcorn illegal. But it wasn't safe for her. And apart from that, legal does not mean safe. Alcohol illegal, and so it's safe for my marijuana illegal in some states, but it's safe for my so we say no doctor the prescribing man I or prescribing more, but it does not also mean that you cannot be addicted to it. Midi no make us say behavior you did so many years are forming no. To me and switching off at once. And to one, yeah, accept said there's a problem. Two, yeah, or pen say yeah, be disum kunu. Now yentia say and yes, switch no dum no aso. And it may take a time. Finally, it is okay to have Christ and to have a therapist. May that's it.
And also be Dr. Philippo for to me. Last but definitely not the least, Dr. Kennedy. The topic in here. Preventive exams and safety. Dr. Kennedy Donko.
Okay, me da so pacho so bi atamenka.
Yes.
Yeah, okay. And to media no mema disclaimer kakra. Say title no say preventive exams and safety. Preventive. Tiwanya anya sa yarena wia, this does not apply to you. Sa testing intervals on the mind, it does not apply to you. So we decide a question about blood pressure testing. So our hypertension, our monitoring system is different from our own need. Yes, preventive exams into our own yanya, otherwise we are healthy, or what some like can. And it's the risk factor and also we are being home come every year. And I mean check it out. That's different from say 1 year already. Also my example back say be a 1 year already and the amount drew. The amount 2 refills. The idea is that refills no sign. You're supposed to come back and see the doctor, not on evaluate to where he will be a word drew. And so you're already those timelines now in terms of testing doesn't apply to you. Where or more otherwise healthy, and I testing or more. And to acquire first testing your normal, you have a time period on time rabbi and you check as opposed to be a or not testing any normal. 10% me and also colorectal exams, there's some updates on the testing age, make I say 50 plus, but it's actually 45 to 45. No, I shall say regular testing to 75. And now between 76 to 85, and only doctor and discuss it to see what's the benefit of it. We are over 85, then it's not really something I'm going to recommend amount. And even 45, so inflammatory bowel disease, be like Crohn's disease, and I say ulcer, you are recommended to even take it earlier. I know Dr. Kambama why I started to cry earlier than 45. And I say, a family history of it, I'm better recommended to be taken before the 45. And last number some once again about safety, and do not near come once and say some of us it take like your friend Abibi drew, and and also a year drew, and sometimes combined with Western medicine, it can affect you in an unsafe way. And he said, "Oh, I got a new doctor. I'm sure say we are catch and say me take you anywhere will be whom I do not all can, but maybe I bring you on one thing credit neither." And the best say you can try to find the English name of adrenal will take and I say herbal adrenal will take be so we here. So we can find the English name now. So I know what my counselor or doctor know who say okay, you also will take away. And yeah, can most of the time say and affect in a bad way. It's okay. I'm because I continue to take it, but I be affected why and also they will inform you. And I'm say and last thing your OTs near can't want some around. OTs just because on by yourself, no prescription. What cause CVS, Walmart, Walgreens, Aquatono doesn't mean say and also you can just take it anyhow. It doesn't mean say it's 100% safe for you because your condition, might require you to do something else. And to know it also debris, Dr. Kasa, or you can even ask your pharmacist based on your condition. They can recommend one medication and answer another medication. 10% me can't and one cell. Now, I mean, may clarify and it will be a bar last time. That was it.
That was a pioneer, I'm sure, Dr. Kennedy. On the lighter side, Dr. Kennedy, go ahead, Reverend is saying. Okay. Presenters in Yanase, Yankopon Shamopa, Mount Boy and Ye this week. At this time, maybe be floor number, so be what questions that we have about an hour. Your panel in our how address the questions in my now before so be first person Betty can ban who said there's a question in the chat. Dr. Ben, not what he can annote T said Dr. Ben, if you can unmute yourself now answers our question. Amaya.
Okay.
Question if free, Kofi or Arisafo. Or say, can repeated daily workout routine therefore become part of the tolerance?
The answer is yes. Your repeated daily routine also become part of your tolerance. It's in American can say initially, like the things you do every day, everything that goes into your daily activity, even standing to brush your teeth, is also part of your tolerance. You'll be amazed how many people cannot stand on their legs and then brush. Even just getting up from seated position, you have how many people? Because it involves something we call some biomechanics of your joints and muscles working together for that to happen. So we need that kind of strength. Sometimes we don't need more. Just imagine Obia. Sometimes we will see from the stairs. If you are getting down the stairs and I say you are climbing up the stairs, mostly having the stairs and it's very common. Now, when you have a knee or problem, imagine if you're crying out fast, you will get it down or up the stairs. When so be quite and no done now we'll see because you've changed the biomechanics and or muscles and don't have the tolerance to do that. Most times when you cross sorry, when so you know what coin musa, but and sorry straight away now so the point is that your daily workouts will become part of your tolerance. Until the drew baby as your tolerance increases, and we say, like we mentioned, 5 minutes, and after always 5 minutes, in pursue. Let me use the word. But say, why Philly say you need to kind of like what? Increase it. Because as you increase your capacity, some of the little things, 5 minutes, is nothing. Like I tell people, say, if you have, I don't think say Jeff Bezos' wife, say be a or 10 iPhone 13 Pro Max, she would worry. Why? Because she has a whole pool of financial resources. So 10 iPhone Pro Max would not be anything. But what to say many I don't think say we must spend money to buy 10 iPhone Pro Max. Even you say, oh, chikramba, wouldn't so be triaka. So those are some of the things say we need to have our workout, therefore will become part of our tolerance. You need to put all those things in. And as you continue to use the workout as your maintenance and as an income, you can get all those things happening. The other thing I wanted to touch on was, Dr. Hannah, since I am on the platform, then I will just help out with that. What I did about Dr. Hannah Kayan, I want to reiterate it. Basically, this yoga principle she's talking about, is more about flexibility. And probably I failed to mention that mostly the exercise principles have what we call the FIT principle, FITT. It is an acronym meaning frequency, intensity, time, and type. Frequency, intensity, time, and type. Yet until I lay the foundation, they say yes. One of the biggest predictors of death was cardiovascular endurance, or I say low fitness. And until I may pass you used to walk in any way, to build that one up. We need to go further. That is what we talk about, the other type of exercises. And the flexibility is part of it. And that is where the issue about yoga need some of this flexibility, because the cat cow, it is not exclusively to yoga. Dr. Hannah showing the legs laying on your back and doing weights is not exclusively. Those are exercises that are done. Yoga for have incorporated or adopted as part of them. Yeah, we'll be able to say child pose. Doing that, it helps with the knees and then the back. Those are flexibility stuff. And to even go further, the whole aspect of the meditation, mostly, it's just about the name, semantics. The whole about meditation and closing and taking it is more of what? Breathing exercise. Now, if I can just chip in just a little bit, Dr. Frank, the point is that most of us don't know, say, your diaphragm now, the home is a muscle. It's a muscle. Now, to say a dome. The interesting part, and it says our diaphragm, and what the costal part, and I say, your ribs, and the chest excursion. There's another part of it, attached to your 5 lumbar vertebrae, L1 to L5. It's attached to it. The other interesting thing is your hip muscles now your tenacity with me a page to do the bathroom doing walking almost attachment and most times say hip near tight because you are sitting so much it changes what we call the mediastinum, the position of the diaphragm. It pulls it into say there was some space. I'm trying not to go into the technicalities, but there was a space behind your back. I call it the zone of opposition. Says our space near reduce, meaning at resting stage, the diaphragm is not in a position to expand. And what happened is most people will start using what we call accessory muscles. Accessory muscles in here, muscles traps, people stress are in their shoulders. Most people use that. We say into your case, obi air hyperventilator. We say most times a person ni pan relax here. Then you can then do deep breathing. The deep breathing aspect simply is that whenever you do that deep breathing, in we say now, one nerve will be a phrenic nerve that comes all the way from your neck, and then a supply will diaphragm with innervation. The funny thing is that anytime Biana obey that different, it connected you your parasympathetic system and will calm it down. And that is the scientific, the physiological process. We can go into details, but it is so linked. And now sometimes, as a clinician, now with my Christian background, says that God says that we are fearfully and wonderfully what? Made. And those are some of the neoma we need to have at back of our mind. They say the whole aspect of that is more about taking the deep breath, kicking in your parasympathetic system, so a bit calm your body down. And that is what mostly you want to do. Because when the stress in any way is by laying down, I say one of the posts of Dr. Hannah Cancer or paper, what that works now. Now we don't night to one, now we don't night to a kunyaswa. Now we don't start to with tamiswa. What we call teaching, what we call normal deep breathing. Now we breathe it through your stomach. You take deep breath through your nostrils and out through your mouth. And then you see your stomach come up and down instead of your chest. Now it calms you down. So basically, those are some of the neoma can once say it can help reduce the stress, and then couple that with the music and the prayer. What a better way as a Christian to help deal with the stress and knowing we have a God that can help you out with that.
Dr. Beneda, I have another question for you, but you take a sip of water and then call Dr. Frida. Also.
Okay.
Elder Eben Wilson, Dr. Frida, say, do we strictly have to measure every single day we eat?
Yo, Medase, question very important. The mechanic said yes, because if you want to maintain a healthy weight, now why your calculation for your basal metabolic rate, and now said how many calories you should eat in a day. In my example, during the Tuesday edition, says, if you want to calculate your age, your weight, and you're a female, now what we see 1,700 calories per day. So did you bro 1,700 calories a day? Gain weight. If you eat under 1,700 calories, you will lose weight. Who did 1,700? You'll maintain. So depending on what the objective you're trying to achieve, whether you want to lose or maintain. And the analogy I'll put it, and they said, hey, Bia, back to money. Send your Dr. Ben Erkano. Say I'm out $1,700. That's all you have to spend in a day. Into unko you sitting on just an opponent kwase is supposed to sustain you for the whole day. Intina is better said out of the 1,700 no. So did you 3 times a day at Chimu 3. Nadi kakra ebia 700 calories in the morning. You want to eat your most calories in the day, early in the day, because while you're most active early in the day, there's more tendency. So burn it that, Not be at lunch, what the 500, not dinner, what the 5, or be more in the lunch, no what to so dinner. So you eat like a king in the morning, not afternoon, you're eating like a queen, not in the evening, no, you eat like a pauper, like somebody at Onisika. So that way, Senya Dr. Ben Kine, you go to bed empty. After you've done your digestive walk, you go to bed empty and then you come in the morning. So yes, it is intentional. You have to be mindful to really watch the calories and stick within the limit. That's it.
Okay, a quick follow-up, Auntie. Given the fact that you are Ghanaians and most of our food do not come with labels, how do you go about measuring our calories in the diet that we eat?
Yes, actually, no. We used to now my make sure Ghanaian measurements here fakakrebi na shese any yese anwa fakakrebi. There is no measurements. But thank God nimbiako so senya mekaya no. When you research at banku first, no, now we didn't know how many calories was in banku. Now no the quantity we are banku it's 248 calories for one banku ball, and that is the size of your fist, the nekakako, just a small one. And now you want to use the portion control now you kind because in piano no we do not have the measurements. So after you have made the meal, no, watch the portion size. It should fit in the palm of your hand. Right? Because we're not living to eat, we're eating to live. Now, if you eat more than that, when it says $1,700, no, it's what it. By the time the day will go, maybe I'm not count $2. You have to eat $2 worth of a meal, which is your vegetables, broccoli, green leafy, Dr. Hannah Kayano. You have to be mindful. Now I balance it. Okay, I will spend here and you may make sure that I'll be below budget. Send it balance it, and you exercise to burn it off. So deep knows that you have to work like an Olympic champion just to get that calories off. And you have to watch it just like money. You won't overspend. You won't have that money to spend. Sammy, I see a share of calories. That's it.
That's a part of the Frida. Obi din at 514 AMW and son and ombe or mutiny Panama Nabano. Dr. Hannah now person answer question. We will say what causes muscle pull in pregnancy, and should that be a concern?
Yeah. So muscle pulling or having muscle concerns in your pregnancy, it depends on where the muscle pull is. It could be, say, ABI is a nerve where the baby during your second, third trimester, from 6 months or 3 months work on, sorry. It could be say na baby or pressing on some nerves be in the back or in your diaphragm or in your uterus, that whole section, or that could cause some problems with muscle or pain. Maybe I now didn't say a muscle, but maybe it's just pain because of nerve problem. And that's maybe a deficiency with some important minerals that you need to take when you're pregnant, because it helps you, stay healthy with your blood pressure, with anyone so nutrients are we here to feel okay. Maybe to say magnesium. I know a lot of the prenatal vitamins now prescribe or they recommend for pregnant women to take. Usually doesn't feel good when you take it. I usually took them at night because if I took them during the day, so if that is the case, I'll try and take it at a time where you wouldn't feel the nausea or vomiting associated with it. Make sure magnesium level is okay. Make sure your calcium level is okay, because and also boil with your muscle. Other than that, if everything is normal and you're just having the muscle problem now, then it could be just normal way of how the baby is positioned in your uterus and how it's causing you to feel, because aprano or you can see it in your uterus. I hope that helps to clear your question. Thank you.
Thank you very much.
Dr. Frank, can I just just a little bit just to add to that?
Yeah, sure.
Another thing that can also cause muscle especially when it comes to in a lot of like fluid accumulation, that can also cause some of the muscle pull, because you don't want that active kind of like pseudo inflammation happening around those areas, because when that happens, the muscles are not getting that nutrition in a constant way, because fluid in that bar and some sort of like retention of it has to go up. And sometimes you have a lot of women having that problem, and also it's one of the reasons why muscle pull, and sometimes like they laying on their back and lifting their legs to say, Dr. Hannah, and doing what we call the static contractions with their leg, and they go up and down like that, and it's able to bring the fluid and like elevation, we're able to draw the fluid, and be able to get a relief of that.
Okay, Dr. Ben, hang on. You're the subject of muscle pull. Minimobia or status or exercise kakrabia no nya contractions, ne abdominal cramps near day. Nippers are then a cause, and what can they do to prevent sudden?
Most times, for such a person, I always want to integrate what one or more hydration level.
Mm-hmm.
Okay, and two, what exactly do they do? What exactly like the exercise, and sometimes even their diet before the exercise.
Okay.
Because sometimes like they can't what the banquet is say or per se you know we say sometimes you can have, sometimes for people it's not like the ebinomo crampono like or more enya like or more eche. When they start to in the if they've not done that for such a long time or more eche. In the way say eche neba na mana why you're uncomfortable. That is why we sometimes tell, like we've been advocating, say start gradually, because the tissues, for most people, when it happened that it's kind of like a shock to the body because that activity have not been done, and the body is trying to find its kind of like way out of it. But if you're able to start gradually, now we are consistent, it gives body enough room to kind of like make gradual adjustment. Right. Into what our advice and Nipano on one shall say with simple exercise, something like our digestive work we talked about. Start gradually, start with the walking, and then you can just be making progressive changes as you go along.
Okay. That's it. Inti meko omo page on 514 AMW.
You I'm penny for Madam was a doctor for our mom dear boy. Say Mamba because many coffee men be. Said ye will see na brabon me car on Tiasia, Debia by 4 year and Nedia by full vacation. Because the no de any kuno. I quite sorry I want to. Now me question is stressing on the need for annual checkup physicals. And the idea me per se multi there because my circle you a chef and son me could be. So now me call and who said and for so I was so nothing. So I'm saying last time I hear before say be who a kum ye bush and nibia na bibisa. Like I said 2019 miniaba or yare confirmation cool year. Now the only way a mammy who you couldn't say I have to pay for a test. The test was expensive. Even we in the creation, I still have to pay. And sometimes it do maybe a opera near opera near New Year beer. It do maybe ourselves more than say obesa. And I think say yenny ya phone kasa because men and none meton ban say me father none impan say nana beto na no munim ne ne kunkum mo busuafo empanifo no omunim enti minim se ye aka mamu abusua bia nim ne kumema enti se ubusa we den abusa beka mi achro na also nyanso ano abomodin se obema omanu ahu na nyese bia hu na wom ana efia bayifo na ye wo nemum aduane die ne lifestyle be adapt e be boa wo no na also why sase na be ya agyanyame bema wo uti waji makonkon ache na abayifo no so yemfa nkwahwom se omo na akuen that's it.
But as a person for the next person me comment on issues I raise here. First of all, most Ghanaians, I don't know, say exposure to them. Of course, person that doctor prescribe a droma na say doctor then a drona or the man na no akono and most of them no nim the integral on no medrono. And sometimes I know more for doctors maybe they are not very tolerant because almost any probably over a short period of time. Omubusa questions but yeah stressing share and for more Ghana no. It's your health. As you advocate for your own health. It's your right to know say a doctor edema yare went no edema and say yare went. Another thing about cause of death, I'm saying a UB Ghana says nipani who outside of the hospital settings and by law no, they are required to do an autopsy. And autopsy in a crime, almost said, Nancy, there was a documentary on the state of mortuaries in Ghana. Or is an eyesore. They were more piling Nipani going to autopsy, you know. Make come from good Ghana health system anymore. For a long time, here called Morga Confanoche. Cause of death, you know, over say autopsies 10, bear 8 of them the same cause of death. Because on that time any thorough autopsy and who the actual cause of death now a man the actual cause a man Nipani ewu, you know. And these are all some of the things I bet me to you for. Now, I'm take your health and then checkups and seriously. I can tell you, say, me practice Ghana for a long time. Not one single time no be buy over for maybe an annual physical, and also buy because say on your riba over na promote. Ghana in hospital, young hospital and say you call for treatment. Yonko for preventive health. In the Yonko for there are more private hospitals, private insurances or Ghana. You move a break atria for families back home. In the encourage you normal using insurance, no, and call for regular routine checkups and a boy empire. There was another hand, Mr. Butters. Okay, so Mr. Butters in anywhere. Dr. Yentumi, no people say, how do you deal with addictions on Kwalemu? Especially younger ones now, they are addicted to their tablets or more laptops, and I don't know. How do we go about dealing with that?
What you made that say? Who's say bank right now? Dealing with them, talking to them about into so and you maybe a war almost so maybe a one year no exercise here. Sometimes you know one can hear sensitivity issues into one here I'll be na obota ya what they can na kwa jinsemu. But you follow me sir. You know sometimes you know so only more we have to be very mindful. But to the specific question as to tablets, you know, first of all, no. Answer about more or the more mono as a settle limits with them. Tablets and for a daily use. And I also say and for debia and also wunya. Right? It is not more or less a right of yours. Say as we only tablet and also have it for X period of time. It's you know I was saying you more enyasa intiasiano to begin with. Eba sa now onim say if you there you menya de come a program so we say there we are menya for 1 hour, then there is that established relationship and I say understanding no e wo ho no say eba so go do middle adolescents side no mu kromo phones ni ade say ye de omo e shase and I say ye de omo shase na mo hu the danger of having these devices you know, for extended period of time on near there. A bedroom no more in Tiasibia or more award the independence to have it no crampono or more side in Yinaswana or more the best guide or more use of these devices. You know. A beyond no a or more share penny phone. It's you know there before tablets in the two or there before phone and conduct any other. But my men no sorry and enough for new credit that or that new credit. And how do you then tell the youth and they say, oh, yeah, man, yenesa. It's in a biono so a moshe. But now so yeah, at this year, I was here the moment. Say, a the yes, no answers now. In P what with that population of Busha phone. There be any amount. Or no question, they say, I didn't name mammy. As an explanation to me, if we don't know the why behind it, the other risk, you know, so say we try to as a deal who show more than baby. Say about the son so now, be anonym the actual why behind it. Then they kind of feel say, oh, Papa no, Adam, no, tramentro, and as they say, oh, you don't even know why. And the trust level no buffer. Kakra me the no.
That's a Dr. Kwame Chey, I say on South, but me person the question about Kuma once. Now we are now the contribution. Our question as also. Elder Wilson, able to say some people exercise and they end up dying. Do we need a doctor's recommendation prior to engaging in a vigorous exercise? Elder, what does your mute?
Okay, thank you. Yeah, a very good question. Generally, almost recommend this say we're above 35. Now, person we exercise. We can take country on whom I hold ba. As on no doctor, a call nya conversation. And na Dr. Ben Ekano. Be our so much deficit. And then you want to jerk the body, especially the heart. We yes pa a day or how ne bedding a bebro. And uti ubomodin say ubun or doctor. Now a day back question I about could be busa anything and mama miss hasono. A day back question so say yenka the importance of physicals and wasem. Dr. Frank Juano Ewo say Ghana for say especially Ghana a treatment. MC Krum has your similar issue in our community. Say or sorry na no baby enye no yadia. Enye when we say no thing. And only one of the misconceptions I say corrected with this addition I say health in yet the absence of illness and also pain. Health here, a bra ya check one. Ne omo hu say bibia ye kama. Na medicine ejina enema be me say so. Diagnosis, intervention, and a management. And don't you say obi yare krom ha no hospital and found say no CTBI e so me labs. No mu what is going on. Or may end blind that you say if you call you no ano na true be near the near the ama omo no krom asa. Because say omo border require that omo normal ranges are so you within it. And until say we are outside of the ranger or intervention I saw them out. And I say omo diagnosis so a bem with management send a ya send new chronic situation which me and yarsa. Until say the channel no more. A friend is saying your tip pain. Sending out Dr. Ben kind of pain here, warning from the body. Or just say BB air conswa and yet. Now there pain on behuno, not a advanced stage. No one can what put yourself into a bigger disadvantage. What outcome is so precarious. One she ya na a jinsemu. And unti and who hear my yina or health insurance. Say periodically, ube schedules annually, ube call for physicals. Na bibi sorry oni pedu anymore. Why then? Omo timi omo etimi aboy. But so by exercise there, by all means, you need to talk to your doctor, especially when you send a menu here. Dear a branch of bitima and mimi to me Sabium. Hey, when I was young, we timbo the whole day, and I mean to me Sabium. And you know, I have to begin gradually. Sani mu be brave. Yeah, over 35. I person continue one. I see who your doctor. Medas.
It has by elder. Ebeko Lydia Odom. Media team is just bet me on me to Mama Lydia Odom. Okay. So Mami Lydia Niwa Yanko Eunice or Tommy Aqua.
Okay. If I talk na me to make a cranty.
Okay.
Yeah. Okay. Intino mesan so mechia mo na nyame sa mo pa woni ma pa moye. Mo akasa bebre na mete hadi na enra no program aye an enwumre about patient any doctor's visit in the no. Say for contributive baby about in right funny reactions by me mammy so nanso that time no conti. Na me pese me so me contribute to nia ye kan ran no kakra about me ankasa me experience with pain pill killer, and I say yeah the mommy hospital because near mommy who say yeah sure hospital, and I say before I be hospital you wouldn't know who answer who call doctor or but near me when say be once they say a doctor no who feel say doctor then was say a ye be beer mouth. Sometimes no who COVID sit one person no what prepare so we be call visit the wouldn't someone who can a boy doctor no money who near how. Na me koye surgery ewo ha na sa surgery no ye me na me be fie no na I was so much in pain. When we say we are surgery na we be fie ye follow up ye friend we be say what to say but that pain was so it was so bad. And you know ya mama nro ma be fie me fa na fe de bin to me cry na you ma frame maybe so ye we dey fa sa ntino after 4 days we start here no na me to my fede it was too much na me call back when we say me buy no mo so ade o mo am surgery wie no when we so sense so ekwaye me scan biem your friend say scan biem o mo person mo hwe sa ade na mo ye no say bibi ankoya no mo e the camera hwehwe ho biem mo ehu bibia so mo say bibia you okay enti me nkofie na me nkoso mfedro no na ebeko me be fie a me ntumi kura pain no meti wo baby a mo aye surgery no enti no kura surgery embolization omo ntwa baby bia but oh say it was too much for fibroid enti ho no na me dwe wodam sa edro we na me fa me feel this how it na me fa I will deal with the pain like that, and that medicine is called Percocet. I tried me didn't no bon mo na ebia mo be hu but ne bon me to me pronouncing your friend of Percocet or something something yes Percocet or something the side no me share dey na me say me fa bi da aha na me buy ya am say for pain yiti me fa okay e da man fa no pain no subside kakra intin ewia na so me say fa no ma fa na pain no man te pain no too much but as normal me say so ti ho na me say no ebi edure ya me fe mom na e ma de no ye kese sa nti omo frame biem no e na me say eduro no man fa ne na me hu say e me say no na ye na omo say sa okay and I mean mama fa me try another ba ku bi omo de ma me ye na me hu say e ye say eduro no mom na e bia na ntimi. And the man send copy hospital one more send goes all through all this internal. Made their my advice and say, "Ye may dry, ye steady ye home. A dry womb for be done. One cause I will steady when so bad one my way who say, I dear be an end, Jimmy. I will try more now work call my doctor ne aye. Secondly, you know, Obi can autopsy as some near it, but may not be new be doing come away. Yeah. Nepal when stage 3 colon cancer ama ne kopie India ya ehwe no motion neti onya ya no o starting kakra wo mo kwa no man manedro wo mo se o bia ye bibi no man manedro e wo Ghana. It took 5 years answer Dr. Nadine ba say okay yen koye endoscopy o say den o mo fa camera nko hwe de ye koso answer o mo hu ye na ye too late. Na etu na stage 3 cancer mu ye ho hwea enhyeda nyame adoma na kakra enti no aha na ye wo no privilege me nyame de be wie masam na ani privilege say ye nya privilege na see educate ye ho wo mo time nyame so mo sua de akire ye no at least aha we are no hospital kram po a wo ye prepare ko ye be sha wo ye no down. But sometimes in your Ghana system would dear and the agent from compare her. And to say, Snahana Sabia, your baby down Sebi. Nan send Jenny, you may know you sing the hospital cry, work or check up with a problem. your first exercise, I have problem. Ye dear me do I have problem, dear. And I mean, when I appreciate Yami and Beam. To me, dear Meso Bian cry say, oh, Yakopamboa, Yakopamboa, young doctor visited, dear, young my friend, the agro, young corner, young doctor, no so no more through God. Amen.
That's a part. I'm saying, yeah, time no it's trying to and keep your comments as short as possible. I don't know, say Elder Tommy Akwana also send a wife and so ever connection. Okay, well, I don't know, so Dr. Frida, if you want to pick this question. Obi Busa about fibroids. I say, can they be cured without surgery? And if yes, what do you have to do to cure it?
That's it for the question. No. My expertise is not really in OBGYN, but the minimum said it depends on the size of the fibroids. No, sometimes no, it's not always surgically removed. They'll give you some advice. Maybe I'll follow with your OBGYN and NASO doctor. They will give you advice on how to, advice on how to control or maintain or deal with the fibroids, but it's usually depending on the size, and they recommend surgery. In Tibia, more time, we can research that and get back to you.
Okay, I had a particular question. And the other consideration here, the symptoms, on say because of fibroid on your menstrual flow now or bleed heavily more than normal. These are all things that come into consideration. And
it's interfering with your fertility and so.
That's correct, yes. And come back maybe count. Depending on your age, and then your fertility goals and they come into play. I know so there are people that promote ABB dry shrink fibroids and we should be very careful of that and your money. The best answer, Dr. Frida, speak to your OBGY. So if you need a referral, catch your PCP. Now refer to OBGY. They'll be the best resource on the answer. Dr. Elder Aqua.
Okay. Me that's a pa. Now, many of my first one on my contribution to enquire addiction from tablets in I didn't say. I've recommended to so many parents. They don't do it. Enquire no the a year pa, especially the child is in the language limited. And I pay a skills be a name be a person to laptop kitwamano. Na ye YouTube videos ebeboano in consultation with the child's teacher na teacher bi was sorry na bibisa fagu laptop no so ohia internet no etimi abo enti eno no limit akwara no from playing so many other things here enye beneficial mano mewie no me second one here question edana me ka I South Korean bia meneno about tennis he's 68 or very strong. Na me cast award na issues me de suggestions no man or energy power 3. Na I did be our taka chemine say. So ran up our catcher maso. And near how thick idea be as a white be a basono. A chre the level of infections at war body. And yeah, Jerry said, I will catch them as who clean it so Arapania and I and pay attention. And so catch them as so no, adiano, minim more than my doctors in the minimum. If I'm sure, is it applicable to us? What do you know? And they say, the question I don't know that.
I don't know who wants to pick this up.
If you have a lot of stuff on your tongue in the morning after sleeping, it's just part of say the body gets rid of a lot of things, and we go through changes, skin cells that die and things like that. In the mouth, that is just a way of your body getting rid of, potential toxins that need to come out of your body, and that's why we have to clean it off. That actually brings me to a point I want to share with our oral care. And say, say, one time a day now is okay. They have tongue cleaners that you need to use something to scrape off those okay from your tongue, because unless you have halitosis or really bad infection in the sinus, you have bad breath. Because that stuff, it smells, is full of bacteria. Into that needs to be cleaned off. And if you have a lot of it, it could mean that you have something going on and your body is just working to get rid of it through your oral cavity. Into the more the worse. So clean it off and have good oral hygiene. And now we choose and now we scrape that stuff off your tongue.
Thank you very much, Dr. Hannah. Ever called David Amponsa?
A doctor for ya damasipi. Yeah, what dear may and Dr. Frida, I will summarize it in the presentations, no? What can I say? Yen treaty breakfast like a king, lunch like a queen, and supper like a papa. Me say, Mammy White, and so I can't say bisa. Me a breakfast person. Me to climb 4:30 a.m. I made the breakfast before I hit the road. But manhunu, including professionals and doctors, you feel quite jumamu, no breakfast. Or so will be a baby earlier, or better now about 2, no needy. And more problems in the saying, one way free fee and no pie, ye need breakfast, or better no a chemo lunch, corano. A problem, Madam say.
That's okay. I don't see any other hand. Men chatting will be busa. Maybe about cancers. Are there cancers that are hereditary? So Dr. Fried and Dr. Hannah and Sansenka, if you can bring it to the floor, no be and the benefit of answers now.
Dr. Hannah Oko.
No, you can go ahead.
There are a lot of cancers that are hereditary. Sanya Dr. Hannah named editorial. Breast cancer, colon cancer, prostate cancer, ovarian cancer, uterine cancer, some skin cancers, bone cancer, brain cancers, some cancers of the fertility organs, some cancers of the eye. So there's a lot of cancers familial, meaning say, so a need be titu if it's like parents, grandparents, sa line noir, there is a tendency or a risk. So it depends. Until now, call Dr. Hona, they do the history. They take your familial history. I know Ghanaians were limited with sa history, but now we can start it from our generation, keeping track of those things. But cancers, it is brought on by lifestyle. And let's say your family history, ABR cancer in them, now I could pick a bad habit of smoking or overeating. You have now compounded that risk factor for your tendency to get cancer along the way. And I hope Metimia answers our question. That's it. Meaning Dr. Hannah will become one.
No, I think that's pretty much what you said. The other thing I can add to it, is also what we eat. Sometimes our exposure to certain food items, some canned foods that have carcinogens, that could also put you at risk for some cancers. Family name. You have to be careful of, canned foods near the use, make sure that it's not expired. Make sure that, as much as possible, eat more fresh produce compared to canned items, because cancer. And Dr. Frida, that was a good point about the lung cancer. But then a lot of us don't smoke. So we think, say, oh, wait, I'm fire. Secondhand smoking, you want to not be around people who smoke, because secondhand smoking, the crack could be worse because you're inhaling a lot of the toxins, exhaling out, through you. And even though you didn't smoke, you've been exposed to carcinogens through that secondhand smoking. And as much as possible, you try to say, hanging around with people who smoke, because we could be increasing our risk for lung cancer as well. Thank you.
Very much. Comfort's Galaxy tab.
I think that Dr. Frank.
Yeah.
You see, Dr. Mponsa, a question, no, you're addressing a question, no, about the breakfast, no.
Okay.
Yes. So maybe, I don't know, Dr. Frederick, you want to help, or see a skipple breakfast, and then wait till later on in the day, like in the afternoon, before they take their breakfast, supposedly. What are the risks? Is there any problems with it, or he's trying to find?
Okay. Now make us all them more my advice.
Right.
So okay, just think about the body, when you let's say a follow lifestyle changes now, bring it to the presentation, say you've gone to bed emptier. Now and remember, calories equal energy if you eat it right. What you didn't too much is stored as fat, not a cow. But if you're doing it the right way, it equals energy, and energy is needed by the brain, by your vital organs, by so many things in the body to perform well. So what could that empty? You really do some benefits of making sure, say you have some hours in between time already dinner to empty. There are benefits in that. And if you see some of the fad diets now, like intermittent fasting and all those things, they recommend that long stretch of time because you're giving your body time to digest it, to turn it into energy for the body and all those things, the digestive mechanisms to work. But prolonged time of not eating, it does hurt you. You don't want to do that for too long. First of all, you are your friends say you're running on negative. You have not nourished the body with the energy it needs to function during the day, for the brain cells and all those things to function. It matters how many hours you've gone empty. You have to make sure, say, you replenish for the day. You're also burning. And there's a point in there where you don't want to slow your metabolism. If you starve the body too long, it thinks it's in starvation mode. It's keeping and holding everything your friend is saying calories the body needs. And we don't want the body to function that way. We want our metabolism to burn and not think that it's in starvation mode. It's trying to survive and hold everything. It may go against you trying to lose weight and keep a healthy weight.
There was a question in the chat about let me get exact. If someone is anemic and they eat too much ice, would they still affect them badly, Doctor?
Yes, I want to answer that question. So I used to have that problem personally because I have sickle cell trait, and for some reason, even though I don't have the disease, I have very low iron level. I used to, like to chew things, and you can't addiction wasn't. And I used to chew a lot of ice, and ice no crown so and so not things that have like BB to say other things that I will not confess on this platform. I used to chew, but on the ice side, it has a link with anemia. Intimipano ya anemic nasa or having the urge to chew ice. It is not good because chewing ice, can lead to dental issues. You can damage your braces. You can damage it. You can break a tooth. It can also damage your enamel, making it, likely to have cavities. Now, dentists, Becca say you have all these problems. If you cannot find another way, usually for me, when my iron level was low, that was when I craved for ice more. Inti say if you continue to crave for ice, that means your iron level is too low. Inti you want to get your iron supplements, and take them, because when you start getting your levels back up, the cravings will diminish, and that is what I do. And I've actually overcome that, but it's a bad habit. Inti try not, get yourself away from that addiction.
That's it. So there are too many questions. Dr. Pokobedi, I don't know if we can go till 5:30.
Yes, you bit take more time. I think that I've been a binom eba. So that is the other thing we need to consider. So
okay, that's it. You better Comfort's Galaxy tab.
Anyway, whilst you're waiting for Comfort, and I think
hello. Okay. Media nankasa no na enye question as such, but time na ye about breast cancer no, and na me was just contribution. Say ye nim say cancer around our family, but recently you realizes that it's not that obi oho ana oni family history. Nanso no wenye bi. Na the empese me kama ye nua no me spare man ye hu ne say cancer no, it can affect anybody from 18 years and up. First, name say ye mpanyimfo nko a enti the mesra omo say bia or a young person now or annual a monthly self breast exam na so feel lump na so feel any change bia no my yanka say me you young na mean to me nya breast cancer. Now your mom say be who your doctors no ma check again early, because early detection is the cure. Intermediate down on person make and yes, me question be I just contribution to me that must say.
That was Dr. Ben.
Oh, I think that what they take the questions anyways.
All right. Mercy Ajeni Boating. Mami Mercy Ajeni Boating, but you wait me on me too.
Hello.
Yes.
Okay, Mpacho, what you mean?
Pachetum Kapa.
Yo, Mpacho, first of all, no, Yadamasipa, ewo. Sa introduce ya mode my bet. My question is say, I don't have problem falling asleep, but it got to a time about 3 months ago. Me da maybe 2 hours through my sleep, no. Bibi anyeme and Johnson me na meniate. Menitia ebetimi taking me about 3 hours. Na mintimi fall asleep. Ebia meni be say ebe kum no na malama boom na was some sorry kwadwuma. Sometimes so ebia na me sorry kwadwonso that would be it. Inti na me pese me hu say or any health issue that is causing that problem na because I don't have problem falling asleep. But in the middle of the night, no we near it.
Okay.
Me that's it.
All right. Dr. Hannah, but you're waiting on.
Yes, I can do that. So what you're saying is that you have insomnia. Insomnia, no, trouble either falling asleep or staying asleep, and it could be a result of different things. Maybe a short term because you might have something underlying going on that you don't know. So again, no, maybe a wako now doctor na your physical or be run a test. Number who say be levels of normal things are well in order, no, are not in where they need to be. Supplement to be to help you with that. Now, say continue for a long time. Maybe more than 3 months, 6 months. Then you'll be worried. Say you're on and off. Sometimes we all go through that. Once in a while, you have just sleepless night. But if something consistent, then I want you to talk to your doctor. And something I can recommend to, again, we're making recommendation. Your hormone be a friend of melatonin. That is actually what helps us to fall asleep, stay asleep. And sometimes that level may be less and, maybe compromised as a result of other things going on in your body. And I can recommend that to you after you talk to your doctor. You can start off, they have very low doses, over-the-counter melatonin. That might help you to support you through that process before I be able to doctor or something. Just make sure you read the labels, talk to the pharmacist, and get some advice before you start taking it. But that's what I might recommend for you in a short period of time to help with that until someone Dr. Bekasa. Yes.
Okay. All those are perfect. Now, one of the things you should also look at is doing like a sleep study. ABI, you might have snoring. As we go older, some things pop up. So you might have sleep apnea. And you want to check, say, ABI said, ABI, maybe you sleep alone. So ABI, I won't realize it. But if you are married and you sleep with your husband, maybe they can observe you, say, or you snore loudly, or it's becoming intense. That's one aspect. But if you don't have that, everything Dr. Hannah said was on point. Intimidasi.
Unless our husband in the
Okay. Butter's family.
Hello.
Yes, sir.
What do you can hear the money answer? My question is, let me a driver and I mean, will labor. I mean, year Jumas or no cigarette pa last year. Me try say, Mabuan no bijay. If this year the iOS cry. Me castle in Jaya. I feel me say on tries a truck in Gramporon. Yes, sir. They be a mecan and a panel on we ever when just say, some I can't improve my reporter, my boss knows. But yes, sir, and a panel on here, a year queen, you know what I'm saying. So I don't know how to go about it. Timo can't win us some no. I mean, bring this question and see. Oh, yeah.
Dr. Pacho, answer will be very answer, no, right? I want to add this. So yeah, you might home health as a home health aid or home health setting. We call patients if you know or no jot and so how do you go about it? Me percent be they can bra question on that yetimi eboa. So when your condition does not
the question to you, what answer in your mind?
Okay. I worked in that role before and me facing that challenge, in most cases, say, yeah, assignments and what I do, they said, I let them know that I cannot stand smoke, right? We say, we look at also year. Until when you let them know, say, it's not healthy for you for X, Y reasons, not agency, they consider. The other thing also said, it's a situation, you can let the company know. Now, if you are a doctor, then your doctor can also give you a note if there's a clinical indication. Give you a note to say this person should not be around such a person. Not affiliate or more to me associate labor no amount because you should not be a victim of the circumstance, right? And my points are not my person making answer. If you find yourself in a situation where and yet say mene cigarette net cigarette for net na ho no ma me pamcho pe akwanya foforo so a ubetumi e de nya exemption from it and yes na say the edika kind no second hand smoking also is very dangerous.
Yeah, well, only 10 minutes. And at 5:15. And me who 3 hands. You fast at 3 no. Yeah, now yeah, wrap it up. And see the next one, a Deuce iPhone.
Okay, Kakana make na obi bisa question. We say young yeah. One is a one cleaner. What are some of the consequences be beating me about? Say one to me and keep you one come especially in the morning. There are so many bacteria and so many activities here. Of course, in the night, and when bacteria and be collaborating me for lymphatic vessels, it me a kidney collaborating me so many complications or kidney be a bit many condition be a friend glomerulonephritis. Mostly no say poor oral hygiene no and it's me confessa but and no people say we have fibroid. Fibroid, there are so many ways you bit me. I treat it without doing a surgery. Your friend is artery embolization and obey injected your friend's embolic agent. I'm an artery supply the uterus on the side na fibroid no. Say you block it, your friend is the artery now. There won't be any blood supply to the fibroid tissue. Means a shrink that will be the dead of the fibroid no. And we say a question be a fasting home. Say usora no pa na wundidi a yanka hu se body no yankopon aye ne say in every sequential ways beyond the body needs secrete certain of substances into the intestine. I say they are ready to digest. And it's a wundidi tembia wundidi a body no kwa betimi a secrete AC hydrochloric acid a eno no wo your friend is stomach ni mu a eno so betimi a cause corrosion of the internal lining of the gastric tissues. No, one 3 year, ubetimi develop your friend is a gastric ulcer. And when in Sanya we say no, say your bomodian didi in a normal way and PBBD and no uncle and chill with Yamukom. More now watch with Yamukono. One okofa another yadie as I diabam. Anna baby is fat and now who say na cronkro achino. And now cronkro ni bo hona ya I drink. Say what you say wa bi ho no drink nyema bi drink nyema bi drink nyema bi a ukoda utimbo pitiri no nyane unyane ade kro na odwen besa be si witrim nti no e ma wuntimi ye de wuntimi na nti no mostly ne ya na stress so most of the contributing factor e ya na e ma nan krokro etimichi a ye ntimi na anajo medase.
All right, Collins, that was a very technical contribution. I'm sure. Suzanne, let me say what was that question back? I mean, encore evidence. If there's time, I'll come to you. But Evelyn. All right, so you're ready. Encore Suzanne.
Me patch me that say me bisa question way because na me na madam fi be na ye kan wase na e margin na ono no he's always the gym or the exercise or your way, but what I see is oh no, he's not working on his cardio, just working on his body. I'll be good body, so when you six packs in your man. And I mean, I say sometimes you're doing all this, no, it's not help. Say it doesn't help, but you say you were working on the cardio, you know, can be good for you. It can be a good way for you because it's like you are cardio is best exercise for everybody. Because sometimes when you who be or fitting the bus, on to communicate, be on to full steps, 100 steps. But you also walk on more do because every day we are not working the cardio, so you know, with move full 100 steps. Let me say those people now they work on their body, but not the cardio, no. And is it good to say yes or yes, sir? Now say you're good for both the body and the cardio. Mr. Mutiasia.
Okay. Dr. Ben.
Well, my main Susanna, I think thank you so much for your question. I think that one of the things, and I'm so happy to say what this our question by. Yes, I've seen quite a lot of things, and I know that men are the most guilty of that. We always want to build those pecs and muscles, just to show off to women who don't even care sometimes about these things. But yes, getting to build those muscles is good. We need muscle strength. But like you rightly advise him, we had the cardiovascular endurance. It is so critical. I've had so many times they've been referred and they've come back to us with so many problems just because of that. Even some of them get caught up in building so much strength and they lose the flexibility part. As a mechanical principle of fit, the frequency, intensity, and type. Mostly I would advise people say, the fitness, cardiovascular endurance, they need to get it. It should be the basics. Then you can build on the strength, the flexibility, and then the balance and coordination aspect. Maybe another time we will discuss those parts in the two as well. But for most of the men, we only go to the gym, so that we can show off and say, I wake up na yakukru na DM kwano. One of the things I always want people to understand is that in Adiana, yes, you want to build muscle mass, something we call hypertrophy of the muscles, but you are not an athlete. We are not doing it for sports. And you know, everything you talk about moderation and also you see people after the map, you're so pumped up and they say, some of them get to a point, it start actually occluding some of the nerve. In fact, in dynamic, one athlete be a minimum, a cutting off the blood supply, so the leg have to be amputated. No, your Olympic, they had to amputate because of that. Because muscle mass and just occlude, because can who say, muscle mass and blood vessels and nerves and nerves need three things. Now, they need mobility, they need space, they need blood supply. Yes, the compartment syndrome. Thank you, Dr. Hannah. They have that. Also, when your tunicate effect, it cut those things off. So you need a balance of the strength and the flexibility, and then the endurance. And it's like you rightly said, you can have bariatric people. I have one professor who is shape physiologically shape in society. But anytime you're back any annual physicals, the biomarkers are always within normal ranges. And sometimes, I always tell people, say, the look does not predict the taste. Sometimes the plate in this Philip Bebe me out. The anene look at corner, but tobacco didn't and quay about cry. If also it doesn't look, some feature of the end and Cahonia, oh dear to say. A whole DNA come
and so you watch your side enough.
So in a nutshell, what they're saying is yes, they look that sometimes even like we are talking about the weight loss, for some of us, you might not physically see, say, you shrunk to problem eye size. But as you consistently do that, and now I send you can, we'll take you, we'll pass history, and now we'll compare. Most time we don't give ourselves so much credit. Yeah, once a young shrink, I'm to say petite body, I say we've done nothing. But just the annual physicals who would tell you first and nanka or calorie level, know what this was. Say, won't say, Ninja say drop within normal range. Yes, or body size might not have changed, but you've done so much to make sure say your body, your what they call it, the biomarkers are within normal ranges.
All right, Dr. Ben, that was a show. I think that we only have 2 minutes. Maybe question Solomon was a while back. Or say you bet me as sustain these presentations because some more treacherous are not you make quick changes, but after a week or two near the area fit. You better yet me as sustain these programs.
Well, the pastor, I think that Pastor Samuel our platform is so pastor. Can you mute yourself and show your face? I think that we are almost. Pastor Samuel is our zonal president for the NAGSDA zonal president. But we as the health department, we'll do our best to make sure say we are so happy for us, so thrilled to say this program has been well accepted by your audience and your presenters and have been so phenomenal in bringing this. And Dr. Frank, what we have right now have been very enriching. We can only, we cannot make any promise now, but we hope to say with what have just happened with this, we can probably find way of continuing with this. Looking at the time of our presenter, a lot has gone into them preparing, and we've taken quite a lot from them throughout the week. And I know, sir, we want to put in a say, I want to safely say, sir, they will be willing to come so that at least we give them next time. My friend Philip and Dr. Hannah Kase, your young Ghanaian musician program in 20 members.
Call because that's stressing me out.
And we will try as much as possible. Say, probably, if not quarterly, probably we see if probably maybe annually we can get to do it. We will think through that with Pastor Mo permission. That's what we hope to be able to do.
All right, thank you very much, Pastor. I be invited for closing remarks and a vote of thanks. So, wait me on me too, Pastor.
Mute to me. Good. Madam Wasibebre. When you comment nearby and I say, oh, mommy, chance to do my
Obit me out the Afra.
Oh, me fanny Afra. All right. Madam Wasi, as a matter of fact, the all kind of change sustainability, no. It's help presenters, Nadia, you have really done your part. More year, more fem dear. The only thing they say, Yenia ye no. Enna, SSE Timmy de Bobra. It is a preaching. We always preach. We preach the same thing from the Bible. Every Sabbath, be preaching, right promotion. It goes on. But yeah, FM dear, intimonso, moya mo fem dear, moya dear. Intini, you can only do what you can do to help us. The only thing is say, yeah, absorb what you bet me putuno into practice. Into Yadamwasepa. Having said that, honestly speaking, wow. I have personally been blessed for the past 7 days. Moya dear papa, when you made the moya juma kese papa, I'm so happy. Say you young people like you, when you me eshramo na muesia dear chiri na muputu mwadisiwa muesian into practice just to share with us, especially fa apumdeho. Abua mi peye. Na minimise audience and also abwa obia. On behalf of the Central Zone pastors and the executive committee, and also Safu Many, I just want to say thank you, and also to our audience. Say mwetimi asopoto ye health evangelism programming. Amene do sabri. As a matter of fact, time kwadi mama mi break it to a be na mfasasi day emma and we ye health leaders. Our Central Zone, Dr. Bidiakon, Dr. Frida Osei, and then Mrs. Alberta Kuma, because they got together, put things together, and then assembled these presenters. Wonderful, wonderful presenters. As a matter of fact, feedback is so very, very positive, encouraging. Edemo Edi. Yeniaji Pay. Dr. Kwamche Jemfi, Dr. Benjamin Opokubedia Komo Udimbio, Dr. Frida Osei, Dr. Hannah Ewu Asim, and then Dr. Filippo Fori and to me, and then Dr. Kennedy Donko. Yet Damwasi Bebre, Wenyame Enshram. Now we can our chat room for say, how can we pay them? Yes, sir, when Yankopa Dumini Shramon, because we can't pay you. Naminim say when Yankopa do betting me a shram. Ama mwejuma moyensu bibia koso kama. Ebio, ye better immediate team nonso asi unia Emmanuel Essien ene kesmetenom ene Denis Opon Checheku mwaya die yepa because ejumedie betima koso jese muboa yeni because juma weni ehia technical team always you should be on point. Now you guys have done extremely well. Yenia so the mwaya pa. On top of it, your outside media team were almost a boa cover sa programming. A year Yonkodo TV. As a matter of fact, a bright message you come out woman any Hope TV. Now very short, but they agreed some better partner with us. Now many yes sir Jumedie. On top of it, yes sir in your Hope for Life. Almost so boy whatever media and then era one. Na nebu ha yen kan Jumedia wedi. Not studios, our Ghana, only desire fly. On top of it, and also so almost apart from so we design fly and Ankasano, woman boy with the backdrop and support. Into Omwa boy ye pa ama Jumedian so ako kama. Na said ye mekayano, this is not going to be the first and the last. The other topic and I'm a person we deal with any oral hygiene by any other stuff. Now we are hoping say in the near future, ya bebo modia say ya besa aye enshishe na mwetimi asa abeboye na jumedie nonso etimi akoso. Na bavo besem daye audience nasi. We can put good programs together, we can execute it, but if people do not show up, then we don't have any program. It's like you go to church, you stand on the pulpit. Whom do you preach to? The church members have to come. The audience have to be there. And especially Ghana, across North America, we want to say thank you. Thank you for supporting our program. Yes, say na onshramu. Ya damwasi bebre. Me de manu be see her.
Amen, Pastor. That was about Dr. Ben.
Pastor, thank you. Yes, say if you actually near Buffalo. Sana I can cast 7 years back.
You refi bibia now the account.
Pastor, where the employee first penny the Jaya Nanka in Suya Asa. But near Bekane said, like you said, will not say much. But on behalf of your team, the various health department and what all the churches, we want to say thank you so much. Some of the notices and then your money came quite late, but you didn't turn your back on us. You've really supported us, the various church, and the leadership, you've been so helpful for us to have this program. Like Pastor said, without you, we couldn't have had this program happen. People like Dr. Nkrumah had to come in.
Oh, yes. Hey, Samuel Abte, Mauro Infino.
Yes.
Hope TV representative for North America.
Yes, we have to pull him all the way from Ohio. Sameh has been spending time with us during the backstage, guiding us what to do with our media. Anyway, he's been so phenomenal. Dr. Benjamin Nkrumah. We are so grateful to these people. And there are so many people who play roles in diverse ways to help us bring this program. On behalf of the Health, we cannot thank you enough. Yes. All that we can say is say, the usual faces, yes, Oliver Trace will always ask for more. So not send a pastor can not in the too distant future. Samuti and Cassie Yabomo 90 say your audience nam yes so say Yamra country say they need more of you. Na ma